A chaotic week at the CDC, raising questions this weekend about whether it can survive after Trump's pick to lead the agency was ousted just a month into her tenure after she clashed over vaccine policy with Health Secretary Robert F. Kennedy Jr., who has long harbored anti-vax views. 4 other top officials resigned in protest. Joining me now is one of those officials, former CDC Chief Medical Officer Deborah Howry. I'm also joined by Tom Frieden, who led the CDC for 8 years under President Obama. He's the author of a new book coming out next month titled The Formula for Better Health: How to Save Millions of Lives, including your own. Doctors, thank you so much for joining me this morning. Really appreciate your time.
Great to speak with you.
Absolutely. Dr. Howry, the CDC has long been the gold standard when it comes to medical and health information. But this latest news has prompted new fears about whether the information now coming out of the CDC can be trusted. So, Dr. Howry, can Americans trust what the CDC will be telling them about vaccines?
So I think it's going to be very difficult to. We have a vaccine committee that's scheduled in a few weeks, and that was one of the reasons why I resigned. That committee is going to be staffed with people that don't have expertise in vaccine science and other types of scientific methodologies, and they've been known to be against vaccines. I am all about talking about data and exploring, but we need to do it scientifically, follow the data, and not make decisions before we actually know what the science shows.
Dr. Frieden, the secretary has promised there will be revelations next month about the causes of autism. And as Dr. Howry mentioned, this Vaccine Advisory Panel, ACIP, is meeting in September after Kennedy fired 17 of those vaccine advisors. So should Americans believe this information that's going to come out?
What we're seeing is unprecedented. There has never been a firing of a CDC director. Public health is under assault. And as Dr. Howry says, it's no longer possible to have any confidence in what's coming out of HHS or CDC. What we see is a pattern: deny, distract, destroy. They deny simple truths and plain facts. They distract from the damage they're doing by the performative stuff that they're doing. And there's a lot of damage, from dismantling tobacco control to not going forward with getting our water safer to undermining our vaccine infrastructure. And they're destroying our health protections. We are less safe.
Dr. Howry, RFK Jr. insisted in testimony to the Senate that he was not anti-vax. This is what he said.
I support vaccines. I support the childhood schedule. I will do that. The only thing I want is good science, and that's it. I have always been a science person, a pro-science person. I believe in evidence-based medicine, in gold standard science.
But Dr. Howry, given the steps the secretary has taken to curtail vaccines, was he truthful in his testimony when he said, quote, "The only thing I want is good science"?
Well, I would disagree when, in the middle of a measles outbreak, he's promoting vitamins over vaccines when we know that vaccines are life-saving. And he also talked about changing our CDC guidance around COVID vaccines. I learned about it by watching Twitter. He had not worked directly with CDC on that guidance, and that was restricting vaccines. So I don't believe he was truthful, or at least if he thought he was, he hasn't been working with CDC or listening to our scientists. None of our scientists have ever briefed the secretary about vaccines.
None of the scientists at CDC have ever briefed him. Is that what you're saying? Not a single one?
On vaccines. Yeah, on vaccines, on measles, on H5N1. And I can tell you, in the prior Trump administration, I regularly briefed HHS.
And what's your reaction to that, Dr. Frieden, that there have been no
I'm
briefings?
stunned, actually. I'm stunned. This is really, really unheard of. Look, this isn't about Democratic or Republican. This is about fact versus fiction. This is about protecting our health versus endangering our health. To have the health secretary not talking to people who've spent their lives studying vaccines and listening to what they're saying is really problematic. And it's one of the reasons we're already seeing damage. We're seeing, for example, as you said earlier, it's going to be much harder in the next few months for healthy people who want to get a COVID shot to get one.
And Dr. Hari, I want to ask you about any personal interactions you may have had with RFK Jr. Did you actually have any interactions with him or his aides? And was there anything that they were pushing you to do that you did not agree with?
So the only in-person interaction I had with him was when he came to visit our campus after the violent attack on it with the shooting. He came to see the extensive damage. I had interactions with his leadership team when they asked us to take a document down prior to the first committee meeting on vaccines. That was on thimerosal. That was so the American public could see the transparent data on this additive, and we were instructed to take it down.
And so what alarmed you, Dr. Hari, the most about what he or his team were telling you to do?
I believe in data and science, and people can make decisions based on that. If you don't have the data and science for the public to see, how can they make their own decisions? How can you have those conversations?
Dr. Frieden, you had just mentioned this about the COVID vaccine. There's been news that the Trump administration would limit the COVID vaccine to people who are 65 or older, or who have medical condition that puts them at risk. So what are the implications of limiting access to the COVID vaccine to just those people?
Well, this is, I'm afraid, just the start. But what it means is that for kids, for pregnant women, for healthy young adults who have a benefit from COVID vaccination, if they want to get a vaccine, it's going to be much harder. Pharmacies may have a hard time stocking it or giving it. Doctors may be reluctant. Insurers may not pay for it. This is in 6 months. Secretary Kennedy has undermined 60 years of progress preventing vaccine-preventable diseases in this country.
Is this, Dr. Hari, is the CDC ready for another potential outbreak?
We were. We had learned a lot from COVID, and we were prepared. Unfortunately, having lost over 2,000 staff and not having our scientific leadership, almost all of the scientific leaders at CDC, myself included, are now no longer at CDC, so we're losing that bench. And with the projected budget cuts, we will not be ready for the next pandemic. I'm concerned. I love CDC, and leaving it this week was heartbreaking, but I had to do it with my colleagues so that we could have these conversations and bring this to light.
Dr. Hari, the president did tap a new acting CDC director, Jim O'Neill. Do you have confidence in him?
I hope that he can do it. Unfortunately, he is focused solely on operations. Have to have that scientific bench around him. He'll be the first acting CDC director who's a scientist or a doctor. So if there is that outbreak or that new bug or pathogen, he's got to have the advice of experts to help him so he knows what to do. And right now, that doesn't exist.
And very quickly, Dr. Frieden, should Americans trust Director O'Neill?
Well, he has no medical training. He will do what the secretary says. I think we have to look past the immediate actions and understand what's going on more broadly. What you're seeing is a dismantling of the vaccine infrastructure in this country and an opening of the floodgates for lawsuits, frankly, that Secretary Kennedy and his friends can continue to pursue for years to come that may deny vaccines and vaccine access to more and more Americans.
All right, Dr. Tom Frieden and Dr. Deborah Hari, thank you so much both for coming on, joining me this morning and sharing your expertise and your viewpoints. Really appreciate your time.